we basically have forgotten all about ounces of prevention and pounds of cure. So everybody winds up dealing with the pounds of cure. And we need to combine the importance of preventive maintenance with the ability to do it. So that's where the skill power comes in. If it's impossibly hard, I mean, if you had to be able to do what Simone Biles does to change the oil in your car, nobody would change the oil in their car because nobody but her can do that.
All right, welcome back, everyone, to another episode of Wellness at the Speed of Light podcast. I'm your host, Dr. Stefano Sinicropi. I know you noticed the background is different because we had no internet at our normal studio. Could not be more excited, and I know you heard all about it in the introduction before this, to have Dr. David Katz on the program today. His medical school, Albert Einstein College of Medicine, is actually where I was born, so that's always exciting for me, and he currently resides in Connecticut, and that, the tri-state area is home for me. So on that note, thank you so much for taking some time from your busy day to be with us on the show today.
Now, Stefano, it's a pleasure. And I know you've had a busy day too, particularly with the change in studios and racing across town to get there. So thanks so much. And also, just before we get going, I just want to thank you for doing what you do. We were talking about it before we went live. And as you were explaining, very conventionally trained and somewhat siloed doing spine surgery, but you see the big picture and you reacted to it. And I've lamented my whole career how many practitioners in biomedicine just sort of stay in their tunnel and don't see the big picture, and the importance of focusing on overall health and overall vitality, whatever our specialty, whatever organ system we're tending to. It's part of something more. It's part of a person who's often part of a family, who's part of a community, who's part of society. And we really need to look outside the tunnel to see the root causes of problems and try to address those. So I really appreciate what you do.
Well, yeah. I appreciate you back for those kind words. I mean, I could not be more excited and passionate. And I just feel a little, it's funny what you bring up. I feel a little bit slighted that somebody like yourself didn't call me, when I was finishing my, my residency, and say, hey, Stefano, I got to tell you, you're missing the big picture here. And it really took me, a decade and a half, because about 7-8 years ago, I started to really get into diet, nutrition, exercise on a rudimentary basis with my patients. But then over the last couple of years, it's really expanded to going back and thinking about how are we managing diabetes? Why are we managing cognitive decline this way? Why is hypertension, why are people coming in so uncontrolled? I can't tell you how many patients we are canceling for surgery because their A1Cs are, in the teens.
Yeah.
And I'm thinking, who is managing these people? Honestly, like, what is going on? So we can simply start there. What is the medical community? And I know I like to ask a lot of really broad questions because we have a very general audience, as do you. I mean, you've been on pretty much everywhere. People can look you up. You've been everywhere. And so my question to you is, why is the medical system, how have we gotten to the point where we're missing the primary goal, which is really keeping people's well-being in order? How have we gone wrong?
You could argue we haven't gone wrong if we expect the healthcare system to be a disease care system. So essentially, we've built what we call a healthcare system as if Humpty Dumpty's problem was the speed of the ambulance response. So the wall is not our problem. Humpty Dumpty's balance is not our problem. Our job is to try to unscramble the egg. So we wait for the fall off the wall and we send in the ambulance, or all the king's horses and all the king's men, and we do our utmost to put Humpty Dumpty together again. But you know what that fairy tale tells us. Can't be done. You can't unscramble an egg. You can't uncrack that shell. But that's what a disease care system does. It waits for things to break and then does the best it can to patch them back together. What some of us recognize is that we could do better than that. We could prevent all these things from breaking in the first place. Maybe it is our job to think about the wall. Maybe it is our job to make sure Humpty Dumpty has balance training and is
Yeah.
sufficiently fit to sit up there, or there's a seatbelt on the wall, or cushions at the base of the wall, or all sorts of different things we could do. That's the big picture. And you came to that, and I came to that. The whole field of lifestyle medicine has come to that. I think more and more people in medicine are recognizing we really don't want to wait until serious, often calamitous illness develops and then react to that. If we can do better, if we can prevent it in the first place, we should be clear to our fellow physicians and health professionals, we are at no risk of putting ourselves out of business anytime soon. Unfortunately, there's plenty of disease to manage, but we ought to strive for a future where there is less disease to manage. And yeah, maybe we could even envision a future where we need fewer health professionals. Maybe we need more wellness professionals and fewer disease care specialists than we currently have. That would be a good thing. Maybe we need more gyms and fewer hospital beds. And so, we really want to think about transitioning over time from just a disease care system to a healthcare system. There's so many reasons why it is the way it is, including the fact that, historically, people lived the lives they lived. And if they got sick, they went to the disease care system. So you could argue that's what we're for. You're for somebody whose back has given out. And as an internist, I'm for somebody who's got a severe infection or diabetes or rheumatologic disease or cardiovascular disease or any of the other conditions they might have. They've got a migraine headache. They've got a bad sore throat. They come to me to find out what's going on and what can be done about it. They don't come to the doctor to be well. And we can juxtapose this whole conversation, Stefano, with what happens in populations around the world. And I routinely invoke the blue zones, and I'm sure you're part of your journey to what you do now involves looking at data from all around the world and how well can people do. And I would argue the blue zones are a great example of how well we could hope to do. For those who don't know, the 5 populations around the world with the highest concentration of centenarians, people who live to be 100, don't get chronic disease, don't get dementia, and more often than not, die peacefully in their sleep. So they live long, they prosper with vitality, and then they go gentle into that good night in the fullness of time. It's about as good as it gets. And they're in Ikaria, Greece, Sardinia, Italy, Okinawa, Japan, Loma Linda, California, and the Nicoya Peninsula in Costa Rica, originally described by National Geographic fellow Dan Buettner. So they show us how good it could be, that we could all have the blue zone blessings. But the interesting thing about the blue zones is they don't say, I live to be 108 with perfect vitality because my doctor's terrific. Nobody's talking about doctors. Nobody's talking about hospitals or clinics. It's a cultural phenomenon. They live in places where the native diet is real food, mostly plants, where physical activity is part of everybody's daily routine, where they don't tend to smoke or be exposed to toxins, where they get enough sleep, where they're not stressed out, where they have a strong sense of community. They have those things embedded in their culture. And so if the goal is vitality, you could argue that the best way to get there from here isn't clinics where we see people very episodically often when something's wrong, but all of culture. But since we live in a part of the world where most people aren't getting there at all, I think people like you and me and our fellows in the healthcare professions need to be the tip of the spear. We need to be in the vanguard of change and say, we really ought to have a healthcare system that actually is a healthcare system. Yes, we should treat disease. Yes, we should address trauma. Yes, we should fix what's acutely broken. But every time we do, every time we send the ambulance to Humpty Dumpty at the base of the wall is another opportunity to ask, what could we have done to prevent this fall in the first place? Because we're not very good at restoring intact vitality once it's lost. So let's try to avoid losing it for the next cohort and the next and the next.
So, I mean, that was great. And I love the Humpty Dumpty reference. And if you're okay, if you haven't trademarked that, I would love to use it in some, I honestly, I love something like that because that's great. I have not heard that before. That's incredible.
I think I came up with that one, but yeah, feel free to borrow.
Yeah, I'll always give you a good friend of mine, Margaret. She's a big wellness advocate. She actually pushed Canada to make a month for Preventative Health Awareness Month. It's called FAM, and she has a saying that I have now completely overused, and that is, we need to try to help patients, and people need to help themselves become the CEOs of their own health. I use that now constantly, but now the Humpty Dumpty reference is really awesome. It's not how quickly the ambulance gets there. Interestingly, we had an amazing fundraiser gala this weekend, and I was thinking that same thing. It was for the cardiac department at this level 1 trauma center that our group covers, and we're the primary orthospine and neurosurgical group there. And it was all about how amazing the getting the cardiac patients to the cath lab, and their numbers are incredible. Honestly, they've done an amazing job, right? Because time is heart muscle. That's kind of
Right.
that's the saying they love to do. But
Right.
why are so many people going there to their cath lab sick, right? It's a culmination of their lifestyle choices, management, all these other things. And I can't help thinking that. I just love the way you think, and you say it so, so well. Sometimes I sit there and I can't help it because I hear buddies talking, and they're talking about how they're managing their patients in the ICU. These are amazing clinicians. They're talking about this one's on dialysis, this one's that. Maybe we can extubate that patient. And all I can think of, I'm glad we're asking those questions, but the other questions are important. Why are our medical ICUs literally overrun, where sometimes there's not even room at the ICU when we're on a red alert because they have to be diverted somewhere else? That's not the society that necessarily
I
want to live in, right?
totally agree, but it's not an either or. And I
Right.
always hasten to point out, Stefano, and I know
Yes.
you're still doing surgery routinely. You're taking care of people with acute problems. I'm no longer seeing patients. I did for 30 years, but I always talk about what a rarefied privilege it is to be a clinician, to be the person that rushes in when others would sort of run away, scared, I don't know what to do, I'm freaking out, right? We are trained to go into those situations, to be there in literally life and death moments, make critical decisions, offer critical help, draw on our hard-earned expertise to make a difference in those moments of greatest urgent need. And being able to do that is an incredible honor and privilege. And I always thought of it as such. But the Humpty Dumpty analogy first occurred to me actually when I was an internal medicine resident, literally. So you and I had the same epiphany, just at different stages in our career. I hadn't yet decided what I wanted to be when I grew up. You knew you wanted to be a spine surgeon. And I said, I'm going to do internal medicine and then figure it out. And while doing internal medicine and being trained, to do those things that are such a privilege, I also thought, gee, 8 out of 10 people in this hospital that I'm taking care of never needed to be here. I mean, if they'd just done a few things differently 10 years ago or 20
Mm-hmm.
years ago, they would have had a totally different health trajectory, and they wouldn't have landed in this hospital bed with me taking care of them, critically ill, with no hope of ever being vital again. And I feel like I'm being trained to be one of the king's horses and one of the king's men, because I could never fully put these people back together again. We've
Yes.
got to do
Yes.
better. So yes, I want to try. I want to be among those who try,
Yes.
do the best we can in these situations. But what about their kids? Is there something we can do to make sure that the next birth
Mhm.
cohort doesn't wind up with the same massive load of preventable, avoidable heart disease, cancer, stroke, diabetes, dementia? And I have to say, some of us have been trying our whole careers. We don't have a lot of triumph to celebrate. We haven't made much progress.
Mhm.
As you're pointing out, the burden of chronic disease is greater than it's ever been. So whatever we've been trying to champion, the relative few of us who've been focused on this, our society has been going in the wrong direction. And it's a
Absolutely.
global problem.
Mhm.
So you could argue that the global society has been going in the wrong direction. There's more and more obesity around the world, more and more chronic disease, lower diet quality, more junk where food ought to be, ever more technology displacing physical activity. People are ever more stressed out, working longer hours, getting less sleep, more exposed to toxins. The one success I think we can most celebrate in the US is the decline in tobacco exposure.
Yes.
Yay, at least that,
Yeah.
at least one good one. Although I would like us to be using that more as a template for how to achieve other successes. But
Mhm.
we've got miles to go before we sleep because our progress has been minimal. I think the best we can say is maybe those of us who've devoted whole careers to this have slowed down the decline. Maybe when I'm looking for a reason for confetti and balloons, that's about the best I could do.
Well, I mean, well, listen, what you've done is honestly nothing short. I mean, you should get a hero's welcome. You know what honestly what you've done. I mean, you're preaching all the things that I really wish I knew. Like honestly, I can't. I feel like I don't want to say slighted because I love doing what I do. I mean, I've done a lot of surgery. I love taking care of my patients, and I love doing, really helping to restore function. Because as when you have a
Right.
horrible spine condition or a bad scoliosis or a bad trauma, I mean, you need help. Like, good luck if you don't have, the right people taking care of you. And that's where we've made incredible strides. Just like like the stuff you do in your field, or the cardiac guys, I mean, it's amazing who we can save.
Listen, brother. I can bring it home. So I practice what I preach. My cardiometabolic health is basically that of an 18-year-old athlete, but I'm a very active guy. I've got a 61-year-old body with a lot of miles on it, and I actually had a sacroiliac fusion. I'm an
Ah.
equestrian. I've been doing pretty rough cross country jumper riding for close to 30 years now. It takes a toll. So I'm grateful to your clan because they're helping to keep me in the saddle.
No, we appreciate it, and for the right things. And that, from our perspective, we preach it. I mean, spine surgery, a lot of people are afraid of spine surgery. We're not going to go down the spine surgery route. If I ever come on your show, we could talk about spine surgery all day. I can go crazy on that stuff. But honestly, like, if in the right people, it's incredible. And I could tell you a
Yeah.
lot of my friends that are surgeons themselves. I've actually operated on some of them, some friends, even though I try not to, but sometimes they ask, and I'll do it. But a lot of my colleagues, I can tell you, spine surgery colleagues, a lot of them have had spine surgery. So not only are they practitioners, but they're also clients because they lose the ability to do what they love doing. So for those things,
Right.
it's great. We
Yeah.
can get into the whole thing is, getting back fusions because you just have back pain. That's a whole other thing that we can talk about on that's a whole other can of worms that is beyond the show. But let me ask you, you know, what so it's a two-edged sword. The way I see it is, we've got to make dramatic changes in the mindset. And you've been trying to do that for your entire career, right? You talk about the Humpty Dumpty analogy way, way back when, right? You came up with this. But so I see it as a two-edged thing. One, it's our colleagues' mentality and the fact that, especially those of us that are allopathically trained, right? You went to Albert Einstein, I went to Columbia. I mean, just hardcore Western MD allopathically trained, right? So there is, and I don't want to use the word, let's not use the word brainwashing because that's what people use. It's a silo mentality. I just do this. I'll let Katz deal with the problem is we're all touching patients. So how can we do better getting our colleagues to start thinking more in an integrative functional medicine kind of hat on, because they're not doing that. We both know that. I know that I wasn't that. I'll be admitted that I was not thinking like that before. And I know this is a very broad question, so you could go as long as you need to go. Then on the population front, when people are bombarded from the time that they're little kids, right? You just write McDonald's and all that stuff. So there's the food aspect of it. There's the consumerism aspect of it. There is this preponderance of reliance on medicine, on pills, procedures for everything, right? Doc, you got to fix me, right? When they get diabetes in the inner city, they say, well, they got the sugar, you get the sugar pill, no problem, you just take that, it's fine. Well, that breeds massive insulin resistance, and it's a vicious cycle, and it's not curing the cure. So can you take on those two things, provider side and then population side? What are Katz's rules for getting us where we need to be in a perfect world? If you could make the rules tomorrow and just say, this is how it's going to be.
I'll try. And obviously, if I knew the answer, if there really were an answer, maybe we would have gotten there by now. So on the provider side, first we have to respect the territoriality in medicine. The structure of medical education goes back to something called the Flexner Report from 1920. So the first thing I would say is we need a new Flexner Report. In other words, we need a new overhaul of medical education. We live in the age of the internet and AI, and we're still running on a mandate for medical instruction that dates to the early 20th century. It's completely anachronistic and obsolete and absolutely silly. So we need enlightened leadership. Maybe it would be our Surgeon General, maybe it would be the Secretary of Health, maybe it would come right from the White House, but we need a mandate to update the entire approach to health and wellness so we do better than just a reactive disease care system. So I think, frankly, we need that. And we also need to respect the fact that medical training really is an apprenticeship for physicians, at least.
Yes.
It's similar for nurses and it varies for other health professionals. And obviously, we're talking about team care, so there are lots of different professionals in the mix here. But certainly in medical school and residency, we talk about see one, do one, teach one. So in other words, if you never see one, you're never going to do one. And if you don't do one, you're never going to teach one. So it's experiential learning. So if you don't have mentors who are actually at the bedside with you, talking about nutrition and lifestyle, you're never going to learn that that's important. And it's going to be very hard then to fit that into your career once your career is already filled with other priorities. So one of the things we need to do is start to populate the ranks of providers with people who do respect that. And I would argue that the American College of Lifestyle Medicine and related organizations around the world are doing exactly that. When I was president of ACLM, we were an organization of just a few hundred. In the decade since, we've passed the 13,000 member mark and are growing at a brisker pace than any other professional organization in the country, to the best of my knowledge, in biomedicine, and have related organizations all around the world. Well, that means thousands and thousands of practitioners in every state are infiltrating the ranks of clinicians and are always talking about this stuff. So you're more likely to see one now than you were before. And if you see one, you're more likely to do one. And if you do one and you appreciate the results, you're more likely to teach one. The other thing we need is reform at the level of credentialing, talking about board exams. So, for better or worse, a lot of education is directed to the test. So if in order for healthcare facilities to be credentialed and to be certified and recognized, they have to serve healthy food. They can't have a McDonald's in the lobby. Well, if that's part of credentialing, then it's going to happen. If individual physicians are recognized for knowledge of disease prevention, health promotion, nutrition, lifestyle factors, if they're obligated to answer questions about that on board exams, they're going to learn that material. They're going to respect that material. So those are a few of the things. So we need some institutional reform where I think the credentialing of medical schools, the credentialing of residencies, and most importantly, perhaps the credentialing of facilities, hospitals, all of which have overseeing bodies responsible for this very thing. And of course, the public tends to hear about the best hospitals from US News Report and others. Well, I think all that credentialing should factor in their attention to not just the treatment of disease in a reactive manner, but the proactive protection of health. And I think that would reverberate. I think if we could achieve the influence we want on the organizations responsible for the fundamental requirements of medical education, I think that would make a huge difference. And if we go all the way to the top, if I were in a position where everybody were actually listening to me, if I were Surgeon General, I'd say it is absolutely absurd to be running medical education on a paradigm established in 1920. When we live in the age of the World Wide Web, access to all information, AI, we need clinicians who are well trained in their specialty, but we need experts at accessing information. It's no longer relevant to memorize a great deal of details unless these are things you're using every day, because all the knowledge, the collective knowledge of the world is at your fingertips. Being masterfully adept at accessing it and putting it to optimal use is critical. And then that basically creates an opportunity for us to restructure the entire curriculum of medical education. And I don't know that we really need to spend as much time studying histology as we once did. Maybe we do, maybe we don't. But we definitely need to make some room in the curriculum for things like nutrition and lifestyle. And then we can celebrate some advances. One of my favorites is culinary medicine. When I went to medical school, and probably still when you did, they taught us biochemistry, patted us on the shoulder and said, nutrition now, good luck out there. I didn't know a single thing I could say to a patient. I wasn't going to talk to them about the arcana of biochemical pathways. Culinary medicine says, here, let's get together and cook a wholesome, economical, family-friendly, delicious, nutritious meal. You can eat it and enjoy it, and you leave here with the recipe and you can share that with your patient. You actually have something practical to talk about. So that's just an example of the kind of thing that absolutely can be done. It's curricular reform, which translates into practice reform. Okay, so that's the provider side, and it could be a much longer story. On the public side, I think there are several different things we need to do. First, I think we need to speak about health differently. I find, and I don't know if you agree or not, Stefano, but I think our culture tends to talk about health as if it always comes at the end of a wagging, admonishing finger, as if it's a moral imperative.
Mm.
You're a
Hmm.
good person if you're healthy. You're a bad
Hmm.
person if you're not. And well, that, there's nothing terribly appealing about that wagging finger.
Yes.
I think it's a totally different value proposition. Health is not a moral imperative. Other things being equal, healthy people have more fun. I don't think we sell it very well. I mean, we should be selling that. Listen,
Love
it's
it.
your life. You're the boss. Probably what you want is whatever you want. But whatever you want as much of it as you can have.
Mhm.
You want the vitality to do whatever you like to do, and you want to keep doing it for as long as possible, whether it's seeing your grandkids grow up or
Yes.
traveling the
Yes.
world or bocce ball or baseball or whatever. My case, riding a horse. I mean, whatever the heck
Yeah.
it is, you're the boss. But here's the thing: the one and only currency that can actually help you buy both more years in life and more life in years is vitality. Other things being equal, healthy people have better lives, longer, better, more years in life, more life in years. That's what health is for. It's yours to decide how you want to spend
Yes.
it, what the things you want to do are, and where you want to do them, and with whom. You're the boss. But healthy people have more fun. I think we should sell health better. I think health should be a thing people really aspire to and want to have and think about and are willing to invest in. And we could, it's not just that healthy people have more fun, they do, but also we could be talking about health like wealth. Look, people are willing to take some of today's money and put it aside. That's called savings. Well, are you willing to invest in your health?
Mhm.
People are willing to give up some of their money so they can give it to their kids. They want to bequeath it. What about health? You know that healthy parents are much more likely to have healthy kids. The single greatest thing we could bequeath to
Yes.
our children is the promise of a long, healthy, vital life. Well, being healthy yourself is 9/10 that battle. Eating well
Mhm.
yourself is the most likely way to ensure your kids grow up and learn to eat well. Being active yourself is the most likely way to ensure your kids grow up to do that. So we're not selling health well. Second, we're not educating health. So we need practical skill training, in particular, in a world where all of the food choices around us are the worst possible choices. They're mostly not food, it's mostly junk impersonating food. We have no skill training. Healthy living in a modern, complicated world cannot depend on willpower. It takes skill power.
Yes.
You think about anything. Riding a bike, you have to learn how to do it. Driving a car, you have to learn how to do it. Pilots, I don't think pilots are better people than the rest of us. They're trained to fly planes.
Sure.
They know how to do what most of us don't know how to do. Spine surgeons aren't better than the rest of us, but they know how
Nope.
to do that surgery, right? You have a special skill set. Well, unfortunately, in the modern world, if you want to eat well, you need a skill set. And I'm an example of that. I'm sure you are as well. We learned how to do it. We're not
Hmm.
better
Yes.
people. This is not a moral advantage. It's just I've got skill power. I know how to choose the
Yes.
best food everywhere I go. I know how to make it work. You deserve to have that same skill set. So we should start teaching that in primary school. So basically at the level of elevate. And by the way, I'm not just ranting. I've done all these things I'm talking about. So we developed at my lab at Yale a program called Nutrition Detective. It was a food label literacy
Yes.
program. We studied it. We published the results. It was for 8 and 9-year-olds. You can start teaching kids to be savvy about their nutrition choices that young, and then you could continue through middle
Hmm.
school and junior high and high school and offer adult education and these same things. So everybody has skill power. And then finally, and again, each of these topics, what do we do about the provider side? What do we do about the public side? This could be a very lengthy discussion. But the other thing is we do need policy. We do need legislation.
Yes.
So I'll bring into the conversation Michael Moss. Michael Moss is a Pulitzer Prize winning investigative journalist, author of two great books, Salt, Sugar, Fat, and Hooked. The first of those, Salt, Sugar, Fat, was excerpted as a New York Times Magazine cover story. And the title of that New York Times Magazine cover story is, and I want you to remember this, everybody, because you could just Google it and everybody ought to take a look at this: The Extraordinary Science of Addictive Junk Food. That's the exact title. So
Wow.
if you just Google Moss addictive, you'll come right to it. Help yourselves. But just let it sink in for a minute. The extraordinary science of addictive junk food. In other words, it's not just junk and it's not just addictive junk. It's addictive junk on purpose.
Yes.
So basically, all the big food companies are paying teams of scientists, giving them the best tech available, notably functional MRI machines, and saying, we want you to play around with formulations that light up the human appetite center like a
Hmm.
Christmas tree. We want food people can't stop eating until their arm gets tired from lifting it to their mouths. And if you guys achieve that, you get a bonus. That's what you're up against. Now, that's not fair. We can't say to
No.
the average soccer mom, suck it up and exercise portion control. She's up against teams
Yes.
of highly paid PhDs whose job it is to make sure she can't stop eating, that her kids
Yes.
can't stop eating, that are,
Yes.
I mean, it's just not fair. So at some point, you've got to say, look, we don't want to have to ask, is there mercury in my French fries? I mean, maybe mercury makes French fries crunchier, but we don't want to have to ask that. We should know you're not allowed
Mhm.
to put mercury in French fries. We don't want to have to ask, is there arsenic in my ice cream? Maybe it makes it creamier, but we don't want to have to ask that question. We recognize that there are lines you're not allowed to, you cannot put toxins on purpose into the food supply. But that's what we're being told is happening in plain sight. The extraordinary science of addictive
Yes.
junk food. So, on purpose, in a nation awash in obesity and diabetes, we are basically propagating obesity and diabetes for profit. That has got to stop. And I don't mind saying, even to a public as politically divided as ours, there are times when it absolutely is the job
Yes.
of policy and
Hmm.
the government to draw a line and say, you cannot cross this line. We do not expect the consumer to have to ask about mercury and arsenic in their food. It's not allowed. And no, you are not allowed to engineer willfully addictive junk food. So there's a short list of things we ought to be thinking about. I want to empower individuals.
Hmm.
Everybody should have skill power, but you should not be on your own working against a society that's willing to mortgage your health for the sake of corporate profits.
That was absolutely brilliant. Honestly, thank you. I mean, I just shake my head the whole time because you're preaching to, you're absolutely preaching to the choir. It's funny because I did a post like a week ago or so from when this is being filmed, and it was my point was about value meals. And so I showed a billboard with the value meal. And I just went on this tirade about value. Maybe today, yes, the food is cheaper. Yes, you might like it. But what is it going to cost you in lost wages, mental health problems, the decline of your physical health, lost mobility, on and on and on. And people were really just really chiming in and pretty excited about it because they're like, it's true. And when you said, put the money away in that bank, right? To save it for your own health, because health is absolutely wealth. It's everything, right? We all know people that don't have their health. They might be billionaires. There's no point. They have no quality of life. They can't spend quality time with their family, on and on and on. But this junk food that is being shoved down our throats, not only at the grocery stores, every commercial, you go to the schools. I mean, we could go on. I mean, I'm sure you could
Yeah,
talk
no,
school
it's
lunches.
it's it it's horrible. But you're right. The value meal, the whole pay now or pay later thing. Yeah, I mean it's like, I'm going to save time and save money by never getting an oil change for my car. Yeah, I mean that's a terrific idea until the engine drops out. So yeah, we basically have forgotten all about ounces of prevention and pounds of cure. So everybody winds up dealing with the pounds of cure. And we need to combine the importance of preventive maintenance with the ability to do it. So that's where the skill power comes in. If it's impossibly hard, I mean, if you had to be able to do what Simone Biles does to change the oil in your car, nobody would change the oil in their car because nobody but her can do that. It has to be easy. So, there needs to be a Pep Boys just down the block where you can go and get a quick oil
Right.
change during your lunch break. So we want to combine it's important and you ought to do it and you can do it. So the same thing with eating well. So, for people to eat well, we need
Mhm.
to enable and empower with education and access, affordable, wholesome food where it's easy to put together a nutritious meal for your whole family. And in fact, there are studies that show that when people have the right skill
Yes.
power, it costs less to do that. And, and that would include knowing, for example, what to do with beans and lentils, which are unbelievably nutritious,
Yes.
can be substituted for meat, save you a ton of money. They're better for your health. They're better for the planet. They're kinder and gentler to our fellow creatures, all that good stuff. But you've got to be able to make stuff your family will actually want to eat, right? So you need to know the recipes. You need to know what to do with these things. That's all learnable. That's skill power. And studies show that when you know how to shop and you have the right things in your pantry and the right things in your fridge, you can make very economical, more affordable than any fast food meal, vastly more nutritious, delicious meal for your whole family in only about 10 minutes more than it would take you to stop at McDonald's on the
Yes.
way home. I mean, that's a tiny, tiny investment and a massive return. And then I agree with you completely, Stefano. If you don't make that investment
Mhm.
early, when you have choices, where you wind up in your life is a place with no choices. So you could decide today, I could make dinner at home, or I could do something to have
Yeah.
a wholesome dinner at home, or I could go to a fast food place. You have a choice. You don't have a choice when you're told your diabetes has been poorly controlled for 10 years and we need
Mhm.
to amputate your foot. You're at it, then all your choices are bad choice. You've surrendered the capacity to make
Yes.
choices. And sadly, that's where so much of our society winds up. Just a quick digression. My father, who's now 84, or did he just turn 85? No, he just turned 85. Is a cardiologist, and we still hike together routinely. And at 85, my dad and I can easily do 6, 7 miles, not even think about it.
That's amazing.
And
Amazing.
some years back, the two of us were hiking together on a frosty winter day, and just loving being together in the woods, and we were reflecting on our patients and how many of them simply can't choose to
Yes.
do something like this because they just got too sick, and then one thing led to another, and one illness led to another illness, led to medications and side effects. And, at some point, there's just too much damage done to go back from there. And it was a feeling of real melancholy. We were
Yes.
loving what we were doing, but we were saddened by how many people the two of us had taken care of over our careers couldn't do this sort of thing. They lost the ability to make a choice. And I think at the level of the general population of our society, people are surrendering that critical thing we
Yes.
all relish, the ability to be in charge of our own lives by not investing in health, by not being empowered to invest in health. And yes, the disease care system needs to do a better job, but we should not underestimate the potential each of us has as individuals to control the master levers of medical destiny. If you avoid toxins like tobacco and excess alcohol, if you learn how to eat optimally, which, as Michael Pollan puts it in 7 words, is eat food, not too much, mostly plants. That really is the gist of it. Mostly eat vegetables, fruits, whole grains, beans, lentils, nuts, and seeds. Mostly drink plain water when thirsty. If you get that right, you just cannot go too far wrong. Find ways to fit physical activity into your daily routine every day, and let it be whatever you most like to do. If you love tennis, play tennis. If you love dancing, dance, but just move. We have a native animal vitality that craves movement, and we kill it.
Yes.
We kill it by basically sticking it on a couch and making it stay there until it dies. And when it dies, you can't get it back. But if you just nourish it by letting it loose and let it do its thing, it will reward you. It's the gift that keeps on giving. More years in life, more life in years. So we have a tremendous capacity to be the owners of our own health, the CEOs
Yes.
of our own health,
Yes.
as you mentioned earlier. And that's empowerment. And we like that, right? I mean, we Americans
Yes.
are very fussy about being in control of our own destiny. Well, step up, folks. You ought to own your health. You should not let corporate America mortgage it for you because it fattens corporate coffers, even as it fattens
Yes.
you and your children. You should not be willing to trade away years in life and life in years for fleeting moments of convenience now. Things that matter to us, we learn how to do. When we were in kindergarten, learning the alphabet and
Mm.
to count was a real pain. Was a real pain. It was a huge investment.
Yes. Yeah.
but on the other hand, we all made it, and it turned out pretty well, right? I mean, I think the ability to do basic math and read has
It's
come in
helpful.
handy many times over the years. Yeah, it's
Sure.
helpful. And riding a bike and driving a car, and
Yes.
all the stuff that's really important for us to function in our world, we invest in the necessary skill set to do it. When it comes to health, nothing. Basically, a whole lot of nothing. The single most important thing, the thing we all wind up focused on, especially in our later years, the thing we most regret when it's gone, nothing. Well, yeah, our society should change to make it
Right.
possible for all of us to have the necessary skill set. But at the individual level, we should all be saying, wait a minute, I want that skill set. Because when enough of us on the demand side say we're not satisfied, the supply will change.
Yes. So, I mean, listen, thank you, Edmund. I love your story with your dad. I know that. I mean, I literally sit there sometimes with my patients and I feel sad when I'm sitting there. And then I
Yeah.
listen to their story and they think that they're coming to talk to me about their back pain or their neck pain. Next thing you know, we are in a deep discussion about how it all went wrong. And sometimes I'm very honest with them. I'm a very kind of conversational, relaxed guy. You know, I grew up in the Bronx. I just talk to the folks when they come in, and I just say, honestly, I just ask them, is this what you envisioned yourself being at 40, at 50, at 60 years old? This is what you want? Like, what are you really looking for from your life? I mean, you've lost your mobility. Your health is terrible. You're hypertensive. Your medication list, you have 19 medicines. You're 42 years old. How did this even happen? And then
Yeah.
sometimes, I mean, sometimes there's tears and all kinds of stuff goes on. And then, but honestly, it
Mhm.
makes a difference us just talking to them. And some of them are, I can't even tell you, I wish I could record some of it and send you some videos, how shocked people are when I'm talking to them about this stuff. And they think, their doctor sent them, oh, you might need spine surgery, go to this guy. And next thing you know, 30 minutes later, we're down this rabbit hole of emotions and meditating and breath work. They're like, who is this? What is this guy talking about? And I said, you know
Yeah.
what, your back pain's, I said, if you do all these other things, you won't even have to come see me for your back pain. You don't need surgery. You need these things. Thanks for sharing that because I love you. It's a melancholy. It really is. It's sobering
Yeah.
because
Yeah.
they're and so one of somebody who's become a really good friend. He's been on my podcast twice. His name is Dan Zeman, and he's a very well-known exercise. He was with the Timberwolves forever, and he was with Greg LeMond for 5 years. We've become really good friends, and we're actually developing this program. It's called the Hypercharge 50, and it's the 50 things that everyone over 50 really needs to focus on. And it's a combination of like biomarker health and meditate. It's just a very comprehensive system. It's not like we're reinventing the wheel, but the more things have names to them and have a strategy, maybe some people go with that and some people go with whatever, but it's just the way of keeping your mobility. Because one of the things he always talks about is, do you want, and it's exactly what adding life to your years. That's really the big thing he talks about. Do you want to spend hiking the last, decades of your life, hiking at 80, 7 miles for an 85-year-old? I want to clap for you. That's amazing.
Yeah.
I hope that I keep living the lifestyle I'm living now, and I can enjoy that with my children too. I'm sure they would appreciate it, and my wife would appreciate it. But he always talks about, do you want to spend 20 years, 30 years completely immobile, right? Dealing with chronic medical conditions and in a nursing home for the last 10, staring outside of a window while your family's out and about doing whatever they're doing, and then just continually perpetuating that. But anyway, yeah, thanks for bringing that up. I just wanted to go back to the policy issue because it's really important. And I'm keeping it broad today because I know we could talk about like minutia of, vegan diets and this and that. And it's great. And we can go through all that. And actually I had Dr. Furman on, and he talked about his nutritarian diet and and it was great. We got into a lot of the minutia, but what I really want to cover is some of these broader topics, which I know are near and dear to your heart. Now, this last week, again, before this was being filmed, a lot of very prominent physicians went to Congress and were lobbying in front of Congress, talking about the catastrophic chronic disease crisis that's going on. I actually posted something because I really want to like pull at the just kind of the heartstrings of the general population. So I actually posted Jillian Michael and her, thing. And again, she's a weight loss specialist. Everybody knows her from The Biggest Loser and this and that. But sometimes that resonates a little bit better with the public. So she talked about toxins in the food. We're poisoning our kids, whatever. No different than what all the physicians were saying, Casey Means and all these other people that are out there testifying. Here's my thing. There's testimonies like that. These are prominent people in society, people who have, especially the physician, they've spent their entire lives doing this. They're emotional about it. The people in the crowd, Congress, the congressmen get emotional about it. I had the privilege of doing some lobbying a couple months ago myself on some health and wellness stuff. Why is it so difficult to make structural changes at that highest level? Like you said, why aren't you the Surgeon General, by the way? I don't have any power, but you've got my vote if you look. But why is it so difficult? Why did all these people go lobby in front of Congress and it's business as usual? Is it corporate interest? Is it just because we've done this too long, or is it just too hard and no one wants to deal with the cold hard facts of what we're facing?
It's two things. First, it's that we in science, we who ought to represent the best of understanding, the best of applied understanding, and the best opportunities for health are far too fractious. So, you've got, I heard a little bit of the testimony. I was actually hoping to be among those who could testify, since I work in the whole food as medicine space now. But a little bit I heard advocacy, for example, for the keto diet, and I'm not a fan. It's a highly restrictive diet. It's very hard to practice. The way most people practice it, it's very dubious for health. I think if what we're advocating for is our particular way, I have a branded diet, the Katz diet, and it's the best, and it's 100%. And that's what I'm about. Well, then, each of us is about a different thing. And if we can't agree where there is, then there's no way to get there from here. The one thing we can say about landing on the moon is it never would have happened if we couldn't find it. If we all had a different opinion about where it is, we never would have gotten there, right? If you want to get there from here, you got to agree where there is. Now, with regard to nutrition and health, I think we can. I've written 4 editions of a leading nutrition textbook for health professionals. I've written review articles, one entitled, "Can We Say What Diet is Best for Health?" Well, if the answer to that needs to be a specific named prescriptive diet, then the answer is no, because that's not best for everybody. Right. But if the answer we're talking about is a general theme, then it's absolutely yes. And that should surprise no one. And by the way, the basic theme of healthy eating for human beings was beautifully encapsulated by Michael Pollan in those famous 7 words: eat food, not too much, mostly plants. And again, we can unpack that and say, mostly eat whole, wholesome vegetables, fruits, whole grains, beans, lentils, nuts, and seeds. Mostly eat those things, and you can't go too far wrong. And that should shock no one. When we think about feeding any species other than our own, we think about the whole species. So we accept that horses are going to do pretty well. I have 2. They're going to do pretty well on some combination of oats and grass and hay. That's because that's what horses are adapted to eat. And by the way, they make massive muscle out of that, right? I don't know anybody who comes anywhere near the strength of a horse. And that massive, magnificent muscle is built entirely out of oats and grass and hay. So all our thinking about protein is misguided. You have to eat this, or no, you have to eat what your kind of animal is adapted to eat. And we could argue about whether or not dolphins should be eating fish, except dolphins are adapted to eat fish, and giraffes are adapted to eat leaves, and on it goes. Well, we're not different. We're a kind of animal. We have native adaptations. They need to be honored. We understand them partly because of physiology, partly because of anatomy, partly because of anthropology, partly because of archaeology, partly because of paleontology. We have a lot of sources of information. Put that all together, the basic theme of optimal eating for humans is clear. Everybody testifying before Congress should be lobbying around. So if we're going to lobby, we need to come together and be an effective lobby and say we're all after the same thing. Now, everything I talk about, Stefano, I try to do something about. So I created a nonprofit years ago called the True Health Coalition, because it was my conviction that experts from all around the world could come together and defend the common ground, even if they preferred paleo, or they were ardent vegan, or they were champions of the Mediterranean diet. Yeah, but can't we all agree that real food, not too much, mostly plants, is a heck of a lot better than glow in the dark Frankenfoods. Can't we agree? And the reason I thought we could agree, I spend a lifetime going to conferences around the world with these people, and I would literally have lunch with world leading paleo diet experts and world leading vegan experts. And I'd say, wait a minute, when the media come to talk to you folks, the public gets the impression that you are in opposing corners throwing things at one another. But I'm looking at your plates, and you, the paleo expert, have a plate full of greens and vegetables and wild salmon, or
Yes.
a
Yep.
lean bison steak or something. And you, the vegan, have the same greens, and instead of the wild salmon, you've got lentils or beans. But your plates are more alike than different,
Yes.
and both are more different from the typical American diet than they are from one another by a long shot. Just tell the public that. So it was a testable hypothesis. Would people be willing to do that? And the next thing I knew, I had hundreds and hundreds of colleagues with very different dietary practices and very different areas of research from 50 countries coming together to say, we agree. We agree about the fundamentals. We agree that they're what matters most. And we agree the public deserves to know this. So first, the problem is us. We have met the enemy, and it is us.
Yes.
We're too fractious. We're too balkanized. We're too opinionated. We're too ideological. We're too dogmatic. I don't think any good menu should have dogma on it. So that's that. And then the second half of the problem is the obvious one. It's money. Basically, members of Congress are very influenced by special interests that fund their reelection campaigns.
Yes.
And there's a lot of money in big food, and the profit margins are huge for ultra processed junk. And so they don't want the status quo to change, the big food companies. Big pharma doesn't want the status quo to change. Hey, perfect arrangement. Let's have a system where big food makes a ton of money by making people fat and sick. And we, big pharma, make a ton of money by treating all the diseases people never needed to get in the first place. So the other thing we need public outrage. If we had clarity where there was, and if parents and loving parents and grandparents.org were the world's greatest special interest group that says you are not mortgaging the future health of my grandchild to fatten the coffers of corporate America, either big food or big pharma, not on my watch. If every loving parent and grandparent said, not on my watch, it would end. We could be the greatest force the world has ever known.
Yes.
And by the way, we could address some other important topics, which we won't get into. But I've long fantasized that loving parents and grandparents, and we have more in common across political divides and ideological divides and religion than routinely gets recognized. And if we could all say we're all going to rally around the things we feel would keep our kids safe in a safe world, all the different issues you could think about, what a force we could be. So there's a lot that needs to be done, but I do think there is tremendous potential to get it done. But the obstacles are the customary obstacles. We have met the enemy, and it is us, because we're more focused on our parochial self-interest. I'm more interested in promoting my personal diet than in arguing for the common ground of sensible eating that everybody could benefit from. Well, that's got to stop. We could say, look, I'm going to emphasize the importance of the common ground. And oh, by the way, I have a preferred variant. Here's my particular approach. You can have both. You can do both. That's fine. But you need to be able to say, but I support the basic principles, the fundamental principles. Those are not negotiable. We can all rally around those. And if Congress is going to do something about anything, it shouldn't be keto versus vegan. It should be, let's enable everybody to eat a diet of real food, mostly plants, make it affordable, accessible, help people have the skill power to know what to do with it. On and on it goes. And then we have to overcome the special interest in maintaining the status quo. And that's a difficulty for the obvious reason. At any given time in the history of any given place, the entities that have the greatest wealth and power are the entities that are profiting from exactly how things are today. They don't want things to change. So power is always concentrated in stasis, because you are right where you are because the way things are have put you there. And if where you are is at the top, you don't want anything to change. So you fight like hell to keep it that way. So you need a massive force to overcome that resistance.
No, absolutely. I mean, and again, I mean, I hope everyone really takes that in. I love the way you said, and I cannot agree with you more that the factions are a huge problem. It's a huge problem, and I can tell you, like, for example, after I had Dr. Furman on, obviously he's a huge believer in the vegan diet. He's written, a lot of people know his books, and are hardcore vegans, or nutritarians, as he likes to call it, and it's very much in line with exactly kind of what you're talking about. Eat mostly whole foods, plants, nuts, seeds, this and that. But when I posted some of the shorts on our podcast that we did together, it's interesting because a lot of the carnivore people, the keto people, they come on and right away the attacks come, right? They're like, oh my God, I've been doing this, it's way better, it's this and that. Instead of saying, wow, that's great, I'm glad that we are making a huge impact, because clearly the longevity studies clearly show that diets based in that general category. And yeah, you can become, a pescatarian and this and that, and that's great for anti-inflammatory.
Flexitarian, Mediterranean,
It's,
absolutely.
I'm more of
Variants on the theme.
yeah, I would call myself more. I try to combine more like of a paleo with an intermittent fasting lifestyle, and it works great. That's what works great for me. I mean, I need to have some of the meats, and I tend to. I mean, my big one's sardines. I'm a big sardine. I just like it. It has a lot of nutritional content. I know we could start talking about
Sure.
heavy metals and stuff like that, but certain brands are better than others, and blah blah blah. But absolutely, what you said about and again, another analogy. Sorry, I have to use the moon landing. If we can't agree where the moon is, we can't get
Can't
there.
get
I
there.
mean, that's absolutely brilliant. So one of the kind of, and I love it because this is we're really getting to the kind of the higher level issues. Let's go back to the different types of diets. Now, you've been, I don't know if you would call it a judge or whatever you'd call it for the U.S. News and World Report as you rank the dietary systems. Would you just rank those for as your, again, we're not trying to put people in factions, but again, you said it best. You just did the one-liner, right? Eat mostly plants, but and whole foods. But when you rank that, how did you come up with can you explain a little bit about to the audience how you came up with that? And again, this is not to put people in factions, but just to understand all of the diets are better than the American diet. I mean, if you're doing any of those things, you are way better than what is engineered for you, which is
Yeah.
why I tell people at least do something, try something that's going to work for you. But how did you come up with those the rankings, and where would you put things on a list?
Yeah. So interestingly, the timing, we're working on the rankings for
Oh, okay.
2025 right now, and I was spending some time on that
And
today. So the scoring mechanism is put together by the editors at U.S. News and World Report. I'm one of, I think, 25 judges, and they basically take us through a whole series of exercises asking about, in this instance, I think it's 38 diets that we're looking at for 2025. The number shifts a little bit year to year. And so, let's look at this in terms of some particular characteristic, cardiovascular
yeah,
health or gut health or brain health. And would you recommend this? And so some of it is as simple as yes or no, and then they aggregate the responses. But a lot of the involvement with the survey involves ranking all the different diets and saying, so for weight loss or for overall health or cardiovascular health, put these in rank order. And then obviously each of us has a limited influence on the final outcome because all of our scores are aggregated together.
Mhm.
What I can say is what I care about. So I'm not interested in gimmicky, go on a diet, get off a
Yes.
diet, do phase one, then do phase two, then do phase three. And then at the end of phase three, you'll be gaining weight again. So go back to
Yeah.
phase one. I'm not interested in any of that nonsense. I'm interested in diets that are fundamentally good for health. I think, many people are interested in losing weight. That's why they look at diets. But if you're not losing weight in the context of finding health, then it's a misguided exercise. Finding health is better
Yes.
than losing weight, and you will lose weight on your way to finding health.
Yes.
But there are ways to lose weight that don't involve finding health. Being really sick makes people lose weight. Not a great value proposition. Taking toxic drugs makes people lose weight. Not good
Yes.
for health. So, we know there are a lot of the cholera will cause you to lose weight. It's not a great
No,
experience.
not
So,
definitely not. Definitely not.
yeah. So losing weight is not inevitably a good thing. You want to lose weight and find health together. So you have to start with a diet that is balanced and sensible and intact. I also think we tend to diet alone, but we live it together. And I've been
Yes.
telling the editors at US News and World Report exactly this for years. So I think appropriateness for a whole family. It's very difficult to go on a
Mm,
diet and leave your family behind. You're never going to maintain that. And if you don't maintain it, what the heck is the point? Because when you
mm,
stop, you're going to gain back the weight you lost and your cardiometabolic parameters will go back to where they were. So you really want something you can share with the people you love for two reasons. First, if it's actually better for you, then you really ought to care about the people you love getting those same benefits. And second, in unity, there is strength. If you try to diet alone for the rest of your life, you will fail. But if you share healthy eating with the people you love and they make you stronger, that's a lifestyle. That's something that you
yes.
can make. So just as a for instance, each year for the past several years, the Mediterranean diet comes out on top, and you could ask why. Well, it's because all of us judges are looking at that and saying, it's not a diet. That's a it's a dietary pattern. That's not diet as in the verb diet. That's diet as in the noun diet. A style of eating from a place in the world where most of us will happily go spend our hard-earned
Yes.
money to enjoy the food. It just
Yes.
happens to also be good for us, so we can love the food that loves us back. Sign me up.
Yes.
And it's adaptable. There are many countries bordering the Mediterranean Sea, so there are variations of the Mediterranean diet that span Spain and
Mm,
France and Italy and Greece and the Middle East and around to Northern Africa. And so that lots of different beautiful recipes from many different cultures
yes.
that could all be part of the Mediterranean diet. But the Mediterranean diet is basically a flexitarian diet. So as you go around the Mediterranean Sea, some people eat meat, some people don't. Some people eat seafood, some people don't. Some eat poultry, some don't. Most eat some dairy, but not all do. But what they all have in common is an emphasis on chickpeas, lentils, whole
Yes.
grains, in particular oats and barley, lots of vegetables, lots of fruits, nuts and seeds, in particular walnuts and almonds, sesame seeds. I mean, these are mainstays
Yes.
all around the Mediterranean Sea, and of course, extra virgin olive oil is a fixture. Just so happens to have very health promoting properties. And by the way, back to you talking about
Yeah.
Joel Furman and his nutritarian diet and the negative comments. Our fractiousness is not just that the carnivores hurl legs of lamb at the heads of the vegans who throw back pointy carrots.
Yes.
I mean,
Yes.
yeah, that's bad. But it's much worse than that. You've actually got factions within the vegan world. So the low fat
Yes.
vegans, they despise the vegans who recommend, dare to recommend nuts and seeds and extra virgin olive oil. So they're all busy throwing things at one another too.
Yes.
So we're even that divided that within what frankly is a rounding error at the level of the population. Some very tiny percentage of Americans have vegan diets, which I think is a good idea. And I'll come back to that in a second. But the vegans can't agree on which version of veganism. So it's very much like religion. Nutrition has become way too much like religion and not nearly enough like science. And in science, what we say is here's what we know and here's what we don't. And in the area of what we don't know, I have preferences and opinions, but they're my preferences and opinions. They're not
Mm,
science. But we have a certain body of science that tells us, yeah, Michael Pollan's right. So the other thing about ranking data, so yes, I've been
yeah.
doing this for US World Report for many years, and I think overall what's good about it is that it shows people there are lots of variations on the theme of healthful eating,
Hmm.
and it empowers people with choices. We also pretty consistently put the same set of diets down near the bottom, and those tend to be really restrictive diets, unrealistic diets, diets that are not consistent with long-term health, diets that are bad for the planet. Those tend to wind up at the bottom of the barrel year after year after year. And I think that's helpful too, because it says this may be popular, but it's a bad idea. All the experts, and look at the diversity of experts
Yeah.
here. You've got
Mm,
PhDs and dietitians, and we all agree we wouldn't feed our families this way. So you want to give it a try, that's your business, but we wouldn't recommend it. So we're
mhm.
both recommending what's good and discouraging what's not so good. What I do now, I left academic medicine after some 30 years, accidentally become an entrepreneur. I invented the
Yes.
first fundamental way to assess diet, introduced in about 50 years. And I founded a company, Diet ID. People can learn more at dietid.com. But the important part for our conversation is we created the concept of a diet map. So you've got diet type on the x-axis. Think of that as longitude, and
Mm,
you've got diet quality on the y-axis. Think of that as latitude. So, with latitude and longitude, you can find yourself in any map. Similarly, if you know your diet type and your
mm,
diet quality, you know exactly what cell you're in diet space. Well, to build out that map, we took every kind of realistic diet under the sun and stratified them into 10 tiers of objectively
Mm.
measured quality, overall quality, using something called the Healthy Eating Index 2020. And what that tells us is that, with the exception of really restrictive diets like keto, where we couldn't get 10 tiers, but for most diets, including a wide array of ethnic diets, Mexican and
Mm.
Cuban and Vietnamese and Korean and Chinese, and for all those different kinds of diets, we could stratify them into 10 tiers of quality. And two things are really important. First, that means you can be in your lane. You know, if you prefer paleo to vegan, okay, you can be in paleo. But the best version of paleo actually has a strong emphasis on plants. And by the way, in the best version of paleo, there's no pastrami, there's no bacon, there are no hot dogs, right? I mean, there's maybe some game, or maybe it's mostly wild fish, but it's a lot of wild plants. And we're really trying to approximate the
Mm.
kind of diet that would have existed in the Stone Age, which is not ultra processed paleo treats.
No.
And
Nope.
when we look across the tier 10 diets, so 10 tiers of quality, when we look across tier 10, those diets are more alike than different. It's another argument, and it's
Wonderful.
empirical. And we just built all these different 10 tiers of quality for paleo, 10 tiers of quality for low carb, 10 tiers of quality for pescatarian and flexitarian and Mediterranean and vegetarian and vegan. And yeah, the best diets, the best version of all these diets are real food, whole food,
Yes.
wholesome food, mostly plants. But if it's paleo, it's not all plants. If it's pescatarian, it's not all plants. If it's vegetarian, it's not all plants. If it's Mediterranean, it's not all plants. If it's vegan, it is all plants, and it could be low fat vegan or higher fat vegan. And we're basically saying these all achieve the same high score and overall quality, and we can empower you to choose the version of high quality eating that works best for you. One final thing I'll say, because you asked, how do I rank?
Yes.
And again,
Yes.
with US News and World Report as a judge there, I'm sort of boxed into their
Mm.
method. But my native view is to say, let's look at diet through three lenses, because there are three things I care about. I'm a physician, so I care about direct effects on human health. How good or bad is a given dietary pattern for the things that affect human health most often? Second, I have three dogs. You're probably seeing one
I
move
see.
around behind me in the chair. I've got three dogs. They're my best friends in the world. I've got two horses. I love them. I am not okay with treating animals with wanton cruelty like we do on factory farms. I'm
Yes.
not saying it's unethical for humans to eat animals, but I am saying wanton cruelty and abuse is unethical. And I don't think any decent human being should want random cruelty on their menu.
Mhm.
So how the way we eat affects food production and how we treat our fellow
Mhm.
creatures matters to me. I think it should matter to everybody. And again, that's I'm not evangelizing. I'm not saying everybody needs to be vegan, but I think everybody should oppose the cruelties and abuses of factory farming.
Absolutely.
And then the
Absolutely.
third thing is, the thing that keeps me up at night is the health of the planet. Our planet is sick. We are making it sick. We are the disease. Basically, we're soiling our nest. There is no planet B. The climate matters. The Amazon matters. The rainforest in Borneo matter. We're doing terrible, terrible, irreversible, irrevocable things to the planet. And a huge part of that is the
Mm.
food supply. And so I care a lot about that. Of the three, the one that's most likely to keep me up at night is worrying about planetary health and how I've seen it decline over my lifetime, and how the forests I love to hike in with my dogs
Yes.
don't look like they used to look. Lots of sick trees. We have weaker trees and stronger storms. It's a really bad combination. So, these New England forests that I've loved my whole life,
Mm.
they're really quite ravaged now. So I look at diet through those three lenses. How
Mm.
does it affect human health? How does it affect how we treat our fellow creatures? And how does it affect the planet? Through all three lenses, there is a confluent emphasis on plant predominant diets, no question about it. Most sustainable, smallest environmental footprint. But then again, which variant on the theme you
Yep.
choose has to be based on what works for you, what you're actually willing to
Yep.
live with, what your family's willing to live with. If you come from a given ethnic, cultural upbringing, honoring that may be extremely
Mm.
important to you. Let's say you're
Yes.
Mexican American or Cuban American, and you want to treat your hypertension with diet. You could say, well, it's the DASH diet for everybody. My way or the highway. I don't think we have to do that.
Yep.
When we look at the Diet ID diet map, the tier 10 version of Mexican American or Korean American or Chinese American, It has all the same nutritional properties as the DASH diet, except it puts it together in a way that actually looks appetizing to somebody who's Cuban or Mexican or
Mm,
Chinese or
yes,
Korean. That's
yes.
so important. So one of the things we need to make sure we do is not invite people to trade off the pleasure of good food against the pleasure of good health. We need to make sure that we empower people to have both because food is an important part of people's lives.
Yeah, I mean, yeah, thanks for that. So number one, I just want to say I love the concept, and I read some of your stuff. I love the concept of taking into consideration planetary needs, inhumane treatment of, I don't even say I don't know if inhumane, I don't know, they're not
Yeah,
humans,
I know.
but
I mean, humane
yeah,
is
yeah,
a
yeah,
bit of
yeah,
a
yeah, yeah, yeah.
misnomer because it implies that
Yeah, I
being like
mean,
a human is a good thing.
yeah, 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 exactly. The way we treat each other. I mean, it's that's a whole other. That's a different podcast. Maybe, maybe we do it together. We get a different guest on. We could talk about how we
Yeah,
treat each other just as people and in the climate. But I think combining those ideas with the food choices are really important because it doesn't have to be, one thing or the other. We can do it all together. But one thing that is for sure that the stuff we're doing now, it's not helping people's health and it's not helping the health of the planet. So we
exactly.
can, I think most rational people could agree that there's not a lot going right now about how we're thinking about it. So thinking about it that way is fantastic, and kudos to you. I wanted to go back to just making things pleasurable. I had Dr. David Barron on. I don't know if you know him, but he's the U.S. Olympic psychiatrist. He was amazing. I mean, he was incredible. I've gotten to know him a little bit, and he was talking about the same thing. It's like from a psychiatric standpoint, from just a mind standpoint, getting people to live these lifestyles. And he's big in lifestyle medicine. He's psychiatric lifestyle medicine. I mean, that's kind of his thing. Having people have pleasurable experiences. That's how we're going to have them better. Just like we can't tell everyone, hey, go to the gym and become a power lifter. No, go out and take a walk in nature or do this with your family or go on hikes with your dad and just enjoy life. That's a great way. Do 6 or 7 miles. Boy, that's great. That's phenomenal exercise. So it's not a one size fits all, and it has to be a lifestyle, which wraps into what you said before. These diets, we don't like the word diet has turned into something else. It's a lifestyle. So, for example,
Right.
like the lifestyle I mean, intermittent fasting. We don't have to get into all that, but I just lead an intermittent fasting lifestyle. I mean, I limit my eating windows to 6 to 8 hours. I don't do like the 2 hour eating windows just because I work out a lot. I'm always in the gym, and then I try to eat healthy in between. It's a lifestyle. It's just what I do, and I do it all the time, and it works well. My labs are good. It's working. It works well for me. Just like if you're a vegan, it's a lifestyle, right? You find the vegan thing. You do that. All these things are lifestyle. So phenomenal, phenomenal point. I just have two more things that I wanted to get into, just being respectful of your time. One of the things that has become a real passion of mine is kind of brain health and mental health. And that's why I've talked to a lot of providers, like I just mentioned, Dr. Barron and other people that are really kind of at the forefront of that. But one of the things that is somewhat underemphasized, but so much is coming out, like Dean Ornish's study came out on veganism and Alzheimer's disease, landmark study. Love to have him on the show and talk about that. But other things, can you talk about, and I know you've talked about like ad nauseum about this stuff. Can you talk about the importance of our mental health, and not only that, just the brain function and how much it's correlated to diet? It's not about the latest necessarily drug that comes out to treat Alzheimer's or it all goes back to food as medicine, what we put on our forks. And that has such a profound effect on the rates of anxiety, depression, early onset, dementia. We could go on. I mean, you just list the mental health condition or brain health. It's all affected by diet, and changing your diet can make a big impact, but it's also massively preventative for some of these things. And so many people don't focus on the brain aspect of it. Could you just, in a nutshell, talk to the audience about how big it is in that field?
Well, so in a nutshell, I don't think anybody needs to hear from me how important protecting brain and cognitive health is because I suspect almost all of us now are touched by the epidemic of dementia. There's somebody in your family who has it. There's certainly somebody in my family who has it. But I've been through this and I know what it's like, and it's devastating. It's devastating for that person, but it's devastating for everybody who
Yes.
loves that person too. So you don't need me to tell you that maintaining your cognition and keeping a healthy brain throughout the lifetime is incredibly important. And I suspect those of us who've gone through the dementia experience with loved ones find ourselves thinking, this is the fate I most want to avoid. Almost
Absolutely.
anything else, however bad, losing my physical capacity, bad, 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 bad,
Mhm.
bad. But being a burden to my loved ones because I'm still here and going through the motions, but the lights are on and nobody's home. I mean, I just
Mm.
dread that. We all dread that. So I don't need to tell you how important that is. I probably also don't need to remind you that in the blue zones where people routinely live to be 100 and don't get chronic disease, they don't get dementia either. So that's important to keep in mind. It is possible for the human animal to live a 100-year span
Mhm.
with an intact mind. Maybe we all are fortunate to know someone, a loved one who's done that, but they're the rarity. They're the exception,
Yes.
not the rule. But in places where people get the lifestyle formula right, where they eat well, they're physically active, they avoid toxins, they get enough sleep, they're not stressed out, and they have a strong
Yes.
social connection to the people in their community, they don't get dementia either. Now, that's not a magic formula for protecting the brain. It's just a reminder that the neck bone is connected to the thorax bone. I mean, the head is part of the body, the brain is in the head. And the things that affect brain health are the things that affect overall health.
Yes.
Over the years, I've been asked innumerable times by editors at magazines and shows, so let's have a special tip about the foods that are best for
Mhm.
glowing skin or silky
Yes.
hair
Yeah.
or good fingernails or brain health or sexual function, or as if you could isolate any organ or organ system or body function from all the others. But if you want a healthy brain, you've got to have a healthy heart. If you want a healthy brain, you've got to
Mm.
have unclogged arteries that deliver
Yes.
nutrients and oxygen to the brain. If you want a healthy brain, you've got to have a healthy immune system, which is constantly patrolling the boundary between the central
Mm.
nervous system and the rest of the body. If you want a healthy brain, you have to have healthy lymph flow. If you want a
Mhm.
healthy brain, you have to have healthy neurons, which are functioning well. You have to have healthy DNA, which allows for
Yes.
neuroplasticity and the regeneration of neurons. If you want a healthy brain, you can't have your body storing excess toxins. So you need a healthy liver, which is a detoxifying
Mm.
organ, and healthy kidneys, which are detoxifying organs, and a healthy
Mm.
gastrointestinal tract, which is detoxifying organs, and a healthy genitourinary tract, which is a
Yep.
detoxifying organ system. I could keep going, but I think you get the idea, right? You cannot
Yes.
isolate the health of any given organ or organ system. It doesn't work that way. Highly interdependent. And
Mhm.
with regard to brain health, what we've come to recognize is that the risk factors for cardiovascular disease are the risk factors for
Yes.
senile dementia.
Mm.
The risk factors for type 2 diabetes and insulin resistance are the risk factors for dementia. There are two schools of thought, and they're more alike than different, but one argues that in essence, Alzheimer's disease is a form fruste of cardiovascular disease, that essentially, as goes your cardiovascular health,
Yes.
so goes your risk for senile dementia, the Alzheimer's type. And the other school says it's more like insulin resistance of the central nervous system. So, as goes type 2 diabetes, so goes your risk of dementia. But frankly, cardiovascular disease and dementia
Yes.
and diabetes rather tend to happen
Mm.
together. So it's really the same cardiometabolic cluster. The risk factors for all the bad stuff that affects the typical body in America is ravaging the typical brain in America. And the best way to defend against it is to keep yourself
Yes.
healthy overall. What things work? A diet of real food,
Yes.
mostly plants, avoiding toxins like tobacco and excess alcohol and other drugs, routine physical activity, getting enough sleep, managing stress, cultivating healthy social connections. Feet,
Yes.
forks, fingers, sleep, stress, and love. That's how I summarize these things. Get those right, greatest probability of a long life with intact physical and mental health. And we're talking not just about
Mm.
cognition and the ability to think clearly, but balanced mood, equanimity,
Yes.
stress tolerance, mental health overall. And I hasten to note, Stefano, you're obviously aware of this, but I think we should tell everybody because otherwise it sounds
Mm.
like we're making promises we can't keep. when we think about optimizing our own health and doing all we can to optimize
Mhm.
the health of people we love, and I definitely think we should both, we should be engaged,
Yes.
all of us, in both of those missions. We can't offer a guarantee. And sometimes people are frustrated. I've actually been at talks where people have said, yeah, but I know somebody, I have a friend who's done all that and
Right.
developed some dreadful cancer. And what I say is the best way to think of this is it's your ship and your crew, and you're the captain, and you want the best crew and the most seaworthy vessel, and you want to be expert at managing ship and sail. And if you have all that, you are far more likely than people who don't have all that to make a safe crossing. However, you will never be in charge of wind and wave. And there are storms at sea that can capsize the best of ships and the best of crews. And that's tragic every time it happens. None of us gets a guarantee. But we do know that if we get this formula right, feet, forks, fingers, sleep, stress, and love, our risk of any major chronic
Yes.
disease, including the major diseases that affect the brain, goes down by 80% or more, which means 8 times in 10 it doesn't happen to you. And that's a beautiful thing. So again, I don't tend to advocate any rarefied formula for taking care of cognitive function. Yeah, I mean, you can do all sorts of brain games and brain exercises. That's
Yep.
absolutely good.
Yep.
Use your brain. I would say the same thing applies to the brain as
Yes.
any other muscle you care about. Use it or lose it. So put your brain to good use, solve problems. Either, you play games and do crosswords, or solve real problems in the world. We need all the help we can get. Work on climate change. Work on preserving biodiversity. There are big issues out there, but taking good care of your body, being physically active.
Mhm.
So exercise of the exercise type rather
Yes.
than exercise of the mental game type
Yes.
is actually what's been shown to have the strongest link to preserving cognitive function for the long haul.
Well, thanks. That's everything. I can't agree with you more. I'm planning some episodes, down the line where we look, the other way when people have gotten sick, anxiety, severe anxiety, depression, Alzheimer's, and things like I said, Dean Ornish. You look at some other guys, Emran Mayer, phenomenal. I mean, he's got all kinds of books out there about changing the diet, all the microbiome stuff and how that affects your brain. Brain health is so important to us, and you hit on the key points. That's the last thing we want to see. I always talk. I had Lori LeBay, who actually, and that hasn't been released yet, but she came up with this program called Alzheimer's Speaks. You should actually look up her. It's amazing, and it's basically a program for people who have Alzheimer's, but a lot of it's for the families, and it's getting all these different resources and things like that. And we got into this whole discussion. I mean, I watched my aunt go through Alzheimer's. It's devastating, and you hit a you hit the nerve. That's the last thing that I'd like to see from myself or any other of my family members. It's
Right.
devastating. I mean, I'd rather just have a massive, coronary when I'm driving and just call it a day or something else. But to live through that, to do that, the fear, the all those things that those patients have to go through, it's so difficult. So thanks for that. And again, without getting into the weeds of using diets to try to reverse some of the things that have happened with brain health, I think your main points that you made about really giving yourself the best tools you can to keep and maintain a good body, a good brain, a good heart, right? Good limb function, all these things is so critical. It goes back to being the CEO of your own health. So the last thing I want to cover, and this, I mean, again, that we could talk about this for an hour. So I just want to narrow it to one topic. And the reason I want to ask you is because you absolutely are at the forefront of looking at different diets and how they work and diabetes and all these other things. One of my favorite sayings, one of my favorite sayings are good doctors know how to prescribe medicine. Great doctors know how to get people off of medicines. So I'll leave we'll start with that. That I know that if I just said go, we'll be here for an hour with your response, but that's not it. One of the things that I always fear when new drugs come out or new things that people are really, really excited about, especially in the setting of a horrible chronic disease, obesity, diabetes crisis that we've got going on, is that we overdo it and we want to put things in the water. What happened with, right? People wanted to put statins in the water. right? That's a whole other, this actually had a lipidemiologist, an amazing discussion about statins versus niacin, and just really, I mean, you talk about getting into the weeds, so far down into the weeds, I'm going to have to give like a translation booklet for people to understand that podcast. That hasn't been released yet, but I want, and you kind of know where I'm going with this, the obesity
Yeah,
crisis.
GLP-1s.
I
Yeah.
have to do it. I have to ask you, I can't have Dr. Katz on my show and not ask you your opinion on it, because I'm getting various opinions from people, and somebody of that's been around for so long like you have and spend so much of your time thinking about getting people healthier, getting them to lose weight, reversing their diabetes. What say you on GLP-1s? Is it, I'll just give you my take on it. I think in the right patient population, it's a tool in our toolbox to be able to help people. I'll leave it there. I'm not an expert on GLP-1s. You are. What's your thought on GLP-1s and how broadly they're being advertised and marketed to the population?
Yeah, it's a great question. I would agree we can't have this discussion and not address it. So let me start by saying I agree with you. It's a tool in our toolbox and the best pharmacologic tool we've ever had. They
Yes.
are remarkably good drugs. And we've had weight loss drugs before, and they've all been quite bad.
Hmm.
We had one that looked as promising as GLP-1s. It was called Rimonabant and marketed as Acomplia, until it turned out, after millions of people had used it, that it was significantly increasing the rate of suicide, and it was
Hmm.
withdrawn from the market. And I do continue to worry that maybe the second shoe hasn't yet dropped for the GLP-1s, and we need longer term use in large populations. But still, a tool in our toolkit. And we use a lot of drugs in medicine that have toxic side effects because it's the best thing we can
Yes.
do. So let me start by saying I agree with you, tool in our toolkit. And as an internist, I've prescribed weight loss drugs and I've sent patients to bariatric surgery. And it's not an either or.
Hmm.
It's a both and. Let's do as much as we can with healthy eating, healthy lifestyle, but some people are
Yep.
going to need more intensive help because they're too far gone, maybe. But let me pose a question or thought experiment for everybody to mull over. Imagine if my company came out with a blockbuster drug that said this drug will, or miraculously, help people recover after drowning. And basically resuscitation rates are astronomically better after drowning if everybody takes this drug. Should we just let everybody drown? Should we stop caring about drowning prevention? Should we say, okay, great, we've
Great
got a
point.
drug now to deal with people after they've drowned so they're not as likely to die from drowning. So let's pull the lifeguards from the beaches, take the fences down around pools, talk parents out of being vigilant with their kids when they're near the water, not teach anybody to swim. Let's just call drowning a disease and throw a drug at it, because we now have a drug that makes it more likely that once you drown, you'll be successfully resuscitated. Essentially, that's the problem with obesity. We're saying we know what's causing this and we know how to prevent it. If everybody were eating well and physically
Yep.
active, rates of obesity would be vanishingly low compared to
Yes.
how they are. And let's just juxtapose drowning and obesity. So imagine that we treated drowning the way we treat obesity. So we basically say drowning is a disease when it happens. And when it happens, we're going to do what the medical system does, bring you to the ER and try to resuscitate you. But we're not going to have lifeguards at beaches. We're not going to have fences around pools. We're going to encourage parents to pay no attention when little kids are wandering near the water. We're not going to teach anybody to swim. And when there's a riptide at the beach, we're not going to put up a warning sign. No, we're actually going to lie, like we do with the marketing of food, and tell you
Yes.
that's what's bad is good. We're going to put up a sign that says, come on in, the water's fine. And then frankly, somewhere along the line, everybody's going to drown, but we'll resuscitate you afterwards because it's a disease and that's how we treat it. I mean, it would be absurd. We know so much about how to prevent drowning, and think about it.
Yes.
Unfortunately, tragically, people do manage to drown despite swimming lessons and
Yes.
lifeguards and fences and all of that. But 99.9% of our
Yes.
effort is prevention. And then we deal with the tragic failures of prevention 0.1% of
Right.
the time, and we
Right.
resuscitate. The problem with obesity as a disease, and we have these remarkably effective drugs, is it overlooks the fact that the disease is in the food supply. The disease is the extraordinary science of addictive
Mm,
junk food that we talked about earlier, and the fact that it's willful manipulation of the food supply to put junk where food ought
yes.
to be. It's willful manipulation to maximize the eating we do before we feel full for the sake of corporate profits. We know about all of that. So essentially, the GLP-1s are an invitation to say, big food, do your thing, make as much money as you can selling people willfully addictive junk.
Mhm.
We'll step in with massively expensive drugs
Yes.
that do absolutely have side effects that may or may not be safe
Yes.
for everybody all the time, and may or may not be safe over the long haul, and may or may not muck around with other pathways in the brain just a little bit. But we'll step in, make a massive profit treating this condition nobody needed to get in the first place. That's the problem. If it diverts our attention from prevention and overall vitality, it's a massive error and a
Mhm.
societal boondoggle. But if we say, no matter what we do on the prevention side, somebody occasionally will drown,
Yes.
and we want the best tools for resuscitation we could possibly have. And no matter what we do on the prevention side, some vulnerable people will succumb to obesity and diabetes. We want the best treatments available. Then that's the place that tool should occupy. So, yeah, some
Yes.
people will need GLP-1s. Now, where we are right now, where more than 70% of Americans are overweight and obese, and over 40% are overtly obese, and severe obesity is getting worse by the year, I'd say there's a pretty sizable role for these drugs until we can turn
Mhm.
things around and do a better job with lifestyle. But if the drugs cause us to say, we're done now, we'll just let everybody get severe obesity and then
Yep.
treat them with pharmacotherapy, we're going to ignore the root causes in our society, that would be tragic. That would be a travesty. And I worry about kids. What are we telling kids? Don't worry about what you
Yep.
eat. Just wait till you are old enough to qualify for the GLP-1 prescription
Yes.
yourself. And then you can, get in line. The economic toll of that obviously is huge. And there is nothing that's ever been put in any pill or capsule that can do for overall health what lifestyle can do. So we
Right.
were just talking about, one of the most important things,
Yes. Yes.
maintaining our cognitive abilities, maintaining our mental health. Well, we know that lifestyle can do that. We have no evidence that GLP-1s can do that. And in fact, there is a hint that, like Ramanaband before them, they may slightly increase suicidal thinking because they are altering
Yes.
some elements of brain chemistry. There's no such thing as a free lunch, and even wonder drugs come with costs not just in dollars, but in potential side effects. So, yes, a tool in our toolkit, the best
Yes.
weight loss drugs we've ever had, remarkably good at a whole range of health effects. I celebrate that. But the notion that we would rely on them exclusively and ignore the overwhelming opportunity we have for the preservation of intact health, the avoidance of obesity in the first place, and the practice of health at the level
Right.
of the entire household, well, we should just not allow ourselves to be diverted from that value proposition.
I mean, that's brilliant. I mean, really, it's about changing lifestyle of the people around us, the population, and it's not about the silver bullet that panacea, that drug, because everything has side effects. I just have to mention, because you talked about the suicidal ideation. So I had Dr. Kenneth Bloom on my program. He is the gentleman who discovered the DR2 allele, which basically basically the addiction for alcohol gene. He should have probably been more recognized than he even is, but he is an absolute genius as far as the pleasure reward center of the brain. We had a very long 3 hour podcast talking about everything that so Dr. Bloom, who I've gotten to know actually pretty well now, it's amazing. I love doing this, by the way, because I end up getting to know people, and I can tell you he's 84 years old. I don't know. I don't know what he's been eating, but his energy levels make me look like I'm asleep. But I can tell you, when I said on that show, when I said GLP-1s, his ears, that he went off on the G. I mean, really. And the reason, his big concern was right on the suicidal potential for it, because it affects the dopamine center in the brain, which is responsible for pleasure. And he is very, very worried and has written to everybody every authoritative board about his concern, and I would probably listen to him as probably one of the most decorated neuropharmacologists ever, as far as his concerns about suicide. And he mentioned that there have been suicides attributed that have been reported to the European societies and even ours. And, maybe it hasn't been has come to the forefront, but he's
Right.
very concerned. So I just had to bring that up because he was very loud and clear. He's extraordinarily worried. And again, he's not saying no one should be on them, because I'm going to argue that if I have a 400-pound, diabetic that, who's not well, honestly, it's a good tool for them if they qualify for it, if they don't have
Uh,
other reasons. Not again,
It,
this
it,
isn't for medical
of
advice,
course. Well,
but,
right. It
but,
may be an alternative to bariatric surgery, and it may be lower risk than the surgery. Everything
but,
we do in medicine involves risk. When you operate, it involves risk, but you do
right.
it because the
Yep.
risks of not operating are greater.
Correct.
So yes, so even if these drugs do have significant risk, there's a place for them. They're a tool in our toolkit, but it's not for everybody, and we should not be thinking they're a panacea. And at the moment, they're the bright, shiny new thing, and there's a little too much fixation. But I also think we're going down the wrong path. We are inclined to
Yep.
think of obesity as a disease, which means there's something broken
Yep.
in the human body we need to fix. No, obesity is not a disease. Obesity is just like drowning. It's just that we're drowning in junk food and we're drowning in technology that's displacing physical activity. And we ought to think about, as a society, what do we do to eliminate drowning? Because if we did analogous things to eliminate obesity, we would go a long way towards solving the problem.
And very quickly, I'm going to sneak one little last thing in. Let me ask you a question. When you turn on the television, okay, for anything, right? Whatever you like watching, does your blood pressure, like mine does it go up when in a 60-minute period, you have to be subjected to 5 different pharma commercials, and then you mix in all the food commercials?
All the food commercials, right?
I
Yes, my blood
honestly,
pressure goes up. Yeah, it's
I,
horrible. And you'd
I
almost
mean,
say
come on, come on.
this is one of those things where you say, look, I don't like crazy conspiracy theories, but it's hard to look at this and say, I have a conspiracy theory of my own. I picture, the bosses of big food and the bosses of big pharma in a cigar smoke filled boardroom, all making this deal and shaking hands and saying, hey, look, we're going to make a fortune making people fat and sick. Then you can make a fortune treating disease people never needed to get. And it's corporate America basically telling you that. So eat this and then take this, and then eat this and then take that, and then eat this. And then, yeah, I mean, honestly, the only reason I don't have hypertension is because I don't watch live TV very much. But the only times I see those commercials is if I'm watching a presidential debate or the Super Bowl. So I mostly watch streaming stuff with no commercials because I don't want to get hypertension watching that crazy parade of here's the stuff to make you sick and here's the drugs you need to take. But
It's
yes, it's maddening.
insanity. And the only reason I do, not that I watch a lot of TV, I do watch some sports stuff, and it's they flood it on sports stuff. But
Yeah,
unfortunately, in our surgical lounges, while we're waiting to get the next case done, if we're just sitting around or just having a coffee or whatever, oh my
TV's
God,
on.
they have live TV, and it's like daytime TV, and it is like one after the. Sometimes there's 3 in a row. I mean, yesterday
Yeah,
there were 3 in a row. And I was just like, I cannot tolerate this. It's unbelievable. But that I'm glad it's not just me. First
it's not
thing I
just
would do,
you.
they always say, hey, first thing I would do when I get into office, wherever, number one, non-negotiable, done. That's over. The commercials have to end.
Yeah,
I don't
yeah,
want to see one more thing for Rinvoq or Skyrizi or any of these other things. The players. It's so funny. It's like a caricature of ourselves. It's a joke. I cannot
yeah.
believe that
I
this
agree.
stuff
That's
is
what it's
out
like.
there.
It's like, yeah, if you were caricaturizing, and I'm pretty sure
Yes.
if extraterrestrials came and saw that, they would conclude there's no intelligent life down here.
No, 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 no. All right. That was amazing. I mean, this was a tour de force. I mean, this was just like just a master clinic. And it was just, I think our audiences could just love it. I mean, there's just something like, there's just so many different things they can take out of this. But the bottom line is, again, be CEO of your own health. I mean, you're saying all the same stuff. I mean,
For sure.
don't, like the Humpty Dumpty analogy, it's just brilliant. Let's go and put Humpty Dumpty back together. Like, and we can do it. We can do it if we
Let's
all,
fix the wall. We'll
yeah,
fix
yeah,
the wall.
and fix the, let's fix the wall, all that other stuff. But there's a lot. I love it. I love it. So can you can you let our audience know where the best places they can find you if they're just really interested, the book, the art, wherever you think is the best place to find Dr. Katz and what he's all about and the things that you're doing such an amazing job on in helping the world.
Thank you. Well, the company that I'm focused on now is Diet ID, and so dietid.com. I have a website, davidkatzmd.com, which leads to my LinkedIn profile, my wife's free recipe site. So all the Katz family greatest hits are yours to enjoy, and various other things I do. So that's probably the best one-stop shopping, davidkatzmd.com.
Well, again, thank you so much for being on. I mean, I've enjoyed this conversation. I wish we had another 2-3 hours to talk to you about it because, I could tell we were just about to get into the more controversial stuff, which is always fun. But I see my role not to be a big conspiracy theorist, controversial guy, but to seriously try to get experts like yourself and take your message and try to get it out to as many people as possible because we need it. We need more Dr. Katz's in the world, and we need to help to spread that message. So I hope that the audience has really enjoyed this one. Again, so much to glean from this one. Could not be more fired up after talking to you.
It's been a pleasure, Stefano. Thanks so much for having me on.
Oh, you're welcome, and you're always welcome on my show anytime you want to come back, and we can get into the weeds, we can get into controversy next time, whatever you think we should be talking about. So thanks everyone for being on another episode of Wellness at the Speed of Light. Again, please take home the message: your health is really your wealth, and if you are not focusing on that, things can go really bad. It hurts you, it hurts your families. Be the CEOs of your health. We'll see you next time on another episode of Wellness at the Speed of Light. Thanks, everyone.